My name is Andrew Steer. I'm a Heart Foundation researcher. I'm an infectious disease physician at the Royal Children's Hospital. I'm theme director at the Murdoch Children's Research Institute of the Infection and Immunity theme, and I'm a principal research fellow at the University of Melbourne Department of Paediatrics. My work started with trying to understand the burden of rheumatic heart disease, particularly in the Pacific, so looking at the number of people, particularly children with rheumatic heart disease, and we developed a number of techniques around screening using heart ultrasounds for rheumatic heart disease. And since that time, and since we've understood that it's a very common disease, it affects about 1 in 30 children, so one child in every classroom in Fiji, for example, where I've worked, have rheumatic heart disease. So from that point forwards, we've been thinking about how to prevent and control the disease. And we're doing that in 2 ways. The first is looking at developing a vaccine against the bacteria that starts rheumatic heart disease, and that bacteria is the Strep A bacteria. And the second is looking at the contribution of the Strep A bacteria in the skin to rheumatic heart disease. And that's a really interesting, new and exciting area that we're trying to answer some key questions about. Rheumatic heart disease is a chronic illness that affects the valves of the heart. So essentially the valves of the heart become scarred, which leads to heart failure and premature death. And it affects 33 million people in the world and leads to 300,000 premature deaths a year, mostly young people and mostly women, sadly. Rheumatic heart disease is caused by an infection in childhood. So increasingly I think about rheumatic heart disease like human papillomavirus infection leading to cervical cancer or hepatitis B virus infection leading to liver cancer. So it's an infection in childhood that leads to a long-term non-communicable disease. We're always taught at medical school that it was an infection in the throat by the Strep A bacteria, but there's increasing evidence that it's also caused by an infection in the skin, so skin sores caused by the Strep A bacteria. And what we know in the Northern Territory of Australia, in the Pacific, there's lots of children with infections in the skin caused by the Strep A bacteria. And most of those children, that infection is initiated by scabies infestation. So scabies is a tiny microscopic mite that burrows under the skin and allows bacteria to enter and cause that skin infection. So there's this cycle of scabies infection, Strep A bacterial infection in the skin, leading to rheumatic heart disease later in life. And so we're looking at ways to intervene along that pathway to stop rheumatic heart disease ever occurring. This area of research is something that's interested me personally right from my medical school days when I was a training doctor, when I spent some time in the Pacific in Samoa, where rheumatic heart disease is also a big problem. And my time there doing some very early research has really inspired the rest of my research career from that point over the last 15 years. One of our big discoveries over the last couple of years was a really key clinical trial that we conducted in Fiji. And it speaks to the potential importance of Group A strep infection in the skin contributing to rheumatic heart disease. And our trial showed with a very simple once-a-year treatment with a drug called ivermectin. Ivermectin's widely used. The discoverers of ivermectin won the Nobel Prize for Medicine in 2015 because this treatment's been given successfully for other diseases around the world. So in this trial, we showed that we can prevent up to 95% of skin infection by Group A strep and by scabies. And scabies is a mite that burrows under the skin that is a really important cause of Group A strep skin infection in the Pacific. And so what is really exciting now is whether we can take that very simple, inexpensive treatment and move it into larger trials to see if we can also prevent rheumatic heart disease. In Australia, rheumatic heart disease is common amongst Indigenous populations. In fact, we have some of the highest rates of rheumatic heart disease in the world. Not in Melbourne, not in Sydney, but in Indigenous communities up north. And it's, rheumatic heart disease is a real indicator of the gap between Indigenous and non-Indigenous people in our country. So rheumatic heart disease is important in those communities. And we also know that Group A strep skin infection is also really common, and scabies skin infection as a driver of that Group A strep is also really common. And so we hope that the research that we've conducted in the Pacific can translate into interventions in Australia as well. And we're working with the right people around the country to help make that vision a reality. For me, the most satisfying elements of research are the discoveries, but probably more important than that is the working with people, specifically working with some of the people we've worked for a long time and developed long relationships with in Pacific Island countries, so in Fiji, now in the Solomon Islands and other parts of the Pacific. And I think for me now, as I'm becoming a little more senior, just seeing the junior researchers develop over time and developing their own ideas and developing their own research projects is, I think, really exciting. And I think also one of the great joys of my research life has been the patients that we interact with as well. So I'm reminded of a young woman called Mbuli Wainangolo, who's a patient with rheumatic heart disease in Fiji. She was the hibiscus queen in Fiji this year, and she's now entered into marine biology at the University of the South Pacific. And she's a young, dynamic woman living with rheumatic heart disease, and seeing her progress through her life with this disease is really inspiring. And in particular, she opened our recent conference, which was on streptococcal diseases in Fiji, and she just did such a fantastic job, and it was amazing to see people living with the disease doing so well. So with my Heart Foundation Fellowship and with funding from NHMRC and other sources, we have now a couple of really exciting leads to follow. So the first is around vaccine development, and we've recently received funding to develop a human model of infection by Group A strep in the pharynx, in the throat. So that's really exciting. It's new, it's novel. It's going to tell us a lot about the immunology of strep infection in the pharynx, but it's also going to allow us to set up a model for future vaccine testing. So I'm very excited about that. And then our second area is trying to show this link between scabies, strep A skin infection and rheumatic heart disease. And so we have funding now to run a large trial with 150,000 people where we use our ivermectin treatment to prevent scabies, to prevent skin infection, and we have the opportunity to look at the effect on heart disease. So that's going to be really big in our field, and we're really excited about that trial. And then the last area is building on our work around screening for rheumatic heart disease. And one of the questions is, for children who have rheumatic heart disease detected by ultrasound screening, what are their outcomes and what can we do to make a difference to those children? And we have funding with some collaborators in the United States and in Uganda to conduct a randomised control trial in Uganda. And so that's also really exciting. It'll be really important in helping to inform not just policy in Africa, but policy globally, including in our part of the world as well.